Patients often ask, how do I find the right doctor to go to? I encourage people to do their homework, and I usually encourage patients to ask their own doctor, their own family doctor, their own internist, someone that they're comfortable with in the medical establishment, who they would go to. The basic criteria for the doctor is in plastic surgery. They should be board certified by the American Board of Plastic Surgery. Hopefully they're a member of the American Society of Plastic Surgeons. Once all those criteria have been met and you come in to meet with the doctor, it's all about bonding and communicating with the doctor. As much as I'm evaluating the patient for what would be best for them, what would work for them, they're evaluating me. And so it definitely is a two-way street. We both have to feel comfortable with each other before we proceed.
I started asking friends for references, and Dr. Levin's name continued to come up over and over again. And I have several nurses and people in the medical field in my family, so I started researching him. And, found out about his background, the amount of time he'd been in practice, where he was head of surgery and different things. So that made me feel better about interviewing him, so to speak, because I was certainly going to be interviewing him first. And after sitting down and meeting with him and really understanding what my options were, felt immensely comfortable asking him to be my surgeon.
When I'm doing a consultation, there's a very important balance between the medical aspect and the art and science aspect. The very common misconception or common concern that people have is that I don't want to have that fake look, that overdone look. I don't want to look too extreme. I hope that you do things more natural. And to me, the best type of plastic surgery is natural.
What I liked about talking with Dr. Levens initially is that he really listened to what I was saying, and he understood what areas were troublesome to me. And he was able to explain to me what he could do in those specific areas to make the changes that he knew would give me a good result, and yet keep me from looking like someone who'd had a lot of work done. It's all very natural in the end. People who don't know me don't know that I had anything done at all.
I feel very strongly about continuing to take care of my patients through the recovery and for hopefully many years.
Over time, I've continued to come back. So I do come back probably twice a year. Now at this point, we have a 10-year-long relationship. And there's no one else I would trust as much as I do him.